Hi everyone. So today I have a very, very special guest with me, Dr. Sam Bunting.
Hi.
So this is a real full circle moment for me because I think before I started YouTube, you were probably one of the only and very few people I watched. It's kind of amazing to me and a bit surreal that now we are here filming together.
It's a huge compliment.
No, really. So the reason why I really wanted to have Sam on my channel was because there are a lot of questions that I get all the time from you guys that I honestly believe need to be answered by a dermatologist. And I can talk about products and stuff like that, but some of the questions are very much about, skin treatment that a lot of times require a lot more than just what you can buy, temporary relief. So I'm basically gonna bombard Sam with all the popular questions I get all the time. So I would love to hear from you exactly what can and cannot be used during pregnancy.
Okay, so I suppose I see women with a couple of concerns typically during pregnancy. Oftentimes they'll be troubled by pigmentation or melasma, which is super common due to the effect of rising hormones whilst pregnant. And I see people with breakouts. So those are the two common situations because the hormones can precipitate either or sometimes both if you're super unlucky. Sunscreen is an essential part of a pregnant woman's armamentarium against the possibility of melasma. And then you get on to the actives which are pregnancy compatible. And again, it depends on the severity of things. Some people get a really bad acne flare. I try to stay away from anything oral for obvious reasons, particularly in the first trimester. But things like benzoyl peroxide are safe. We on prescription can use certain topical antibiotics safely. We can safely use azelaic acid. Now, azelaic acid is a great ingredient because it's beneficial not only in acne, but also in hyperpigmentation, and additionally helps with redness, texture, and pores too. So I would say that is one of the commonest things that I recommend to pregnant women in my practice, that they can use safely alongside sunscreen. And a lot of women are most comfortable using all physical sunscreens with zinc oxide, titanium dioxide. Other anti-aging ingredients that are safe would be vitamin C, niacinamide, hyaluronic acid, and peptides. So I think there are plenty of options.
Any concentration vitamin C? Because now you've got things that are 30%.
I don't think you need to go higher than 20%. I think the clinical data suggests that is probably enough, and that beyond that you probably run into greater risk of irritancy, and pregnant skin can be sensitive skin.
What should you steer clear of when you are pregnant?
So I think the main no-no that is commonly used would be the retinoid category. Vitamin A, we know, is teratogenic orally, so in the form of Roaccutane, which is a common treatment for acne, but is 100% no-no when it comes to someone who's trying to conceive. So we extrapolate from that and we say no topical retinoids either. Some people say to avoid salicylic acid, others are comfortable with it. My general rule is because we can use benzoyl peroxide and azelaic acid safely, those are the things I go to in context of blemishes and breakouts.
Just to be safe, basically,
100%.
right? To err on the side of caution.
Pregnancy is a privileged state and we should treat accordingly. The other category that's really safe is AHA. So glycolic and lactic acid are safe and will give you a nice brightness and smoothness, improvement in texture. They don't have quite the same wow factor as retinoids, but they're a good alternative.
Retinols and retinoids, some people just have less of a good experience with it, or their skin is less tolerant to it.
In the clinic, I see people who want more than perhaps is available over the counter. And I think that, again, there are quite a few tricks that you can do to get somebody using a retinoid who maybe had a negative experience before. I mean, buffering, applying retinoids over moisturizer, for instance, using them less frequently, even diluting them with moisturizer to make them less strong. It's like a ladder. You can. You had a bad experience.
No, I just wish my dermatologist told me that when I did the first time I went on Tret. And I went on it for hyperpigmentation.
And had you been on a retinoid prior?
Never. It's my first
time. You
time.
went in cold.
0.025%. And I said, how do I apply it? Every day. They said, every day apply it, right after cleansing your skin.
So, okay.
So the first few days, you
don't feel anything. Yeah. And then you get quite a glow on. And then
you're an amphibian, basically. It's just so frightening. But
it's a challenge. I mean, unless somebody kind of knows their own skin, and I can see that their skin is naturally quite thick, maybe they're a little on the oily side, and it sounds like their skin has behaved in a tolerant fashion in the past. Somebody with thinner skin, history of sensitivity, some products not suiting them, I would go in more gently. But I think I would do one active at a time. I would do it every third night for 2 weeks, and every second night, then every night of that, and only increase to the next level when there's a level of comfort. You tell them what to look out for, and it's almost always dryness and peeliness around the mouth. It develops around 3 p.m. and you realize you've got like a little crispy thing, on your chin. It's like the worst thing in the world.
It's funny because someone said, you have a beard. Right now you have a beard. It's all flakes.
You skip a couple of nights, you moisturize like crazy. Maybe that day you don't put foundation around your mouth because nothing looks worse, right? And also understanding that it really isn't about doing it every day. And the other thing that I found so helpful is to quantify visually the amount that I want them to use. Because if you give a tube of tretinoin to 10 different people, they will use 10 different quantities.
Yeah, absolutely.
And then how to apply it. I developed this silly thing called the 13 dot technique.
I love that.
So obvious,
I actually
right?
Because it makes sure that you're evenly.
100%.
Yeah.
And when you're dealing with a pee, it's pretty hard to make that go evenly all over.
Oh, forget it. It lands here.
Exactly. And then you get dry. So it really does encourage this thin, even distribution, which I find to be helpful, particularly for newbies. Less frequently, buffered over moisturizer. Niacinamide is a great partner to making retinoid tolerance much less miserable.
I got that tip from you.
Pre-treatment really helps. Yeah. It's a tough love thing with the retinoids, but the benefits, I can tell someone's using retinol from across the room.
Yeah. Oh, really?
Yeah, I think so. I think it delivers a quality to the skin. It's obviously not for everyone. There are people who are their skin type is just not suitable. But I think where it suits, it is a real game changer.
Yeah. For someone like me who is rosacea prone, Tret is not the easiest or not the most suitable thing to use. But I think over time, gently, slowly, over a period of years, it's something that I'm able to tolerate.
100%. I think particularly if you pre-treat with azelaic acid, there is something in azelaic acid's ability to turn down the skin sensitivity levels. And that's what I find most helpful about it. Not only does it help, with the active side of rosacea, the inflammatory lesions, but it does help with reducing skin sensitivity over time.
So speaking of rosacea, as far as routine goes, what would you tell people to avoid, to be careful of, and what to include?
Yeah, so I think the what to avoid is a really important category. So anything with friction. So I avoid physical exfoliants,
Clarisonics.
Oh gosh, no, absolutely. That's just, barrier trouble, unfortunately. So no physical exfoliation. I tend to encourage nothing rougher than the finger pads for cleansing. Minimize use of flannels and cloths and things like that. Fragrance, big no-no. And I think you have to be careful of products with a lower pH. I think the sensitivity factor is undoubtedly there. Essential oils, again, I just don't think they're suitable for people with rosacea-prone skin on the whole. And then to start them with the basics of good quality sunscreen, and oftentimes all physical block will be best for them. It just tends to be less irritating in terms of the filters, so zinc and titanium. Azelaic acid is probably the best over-the-counter and now increasingly accessible active ingredient for those with rosacea. But I think if it's active enough, you need a doctor, you need a prescription.
Absolutely. All right, can we talk a little bit about hyperpigmentation?
Sure.
Because that is one huge subject on my channel.
Okay, so first thing, as you've rightly pointed out, there are different etiologies, so you need to know what you're treating. So is it inflammation leading to pigmentation, so PIH, post-inflammatory hyperpigmentation, so that will naturally follow where you've had your blemishes. So in an adult woman, you'll have blemishes here, and then red or brown marks depending on your skin tone. Whereas melasma is a condition typically seen in women, although men can be affected by it. It has a very characteristic distribution.
Fair. I've never seen a man with melasma.
I mean, it's 90% female, 10% male.
Okay,
so I've definitely seen cases in the practice. But again, it's characteristic, it's sort of these sort of map-like brown or grey splodges in the forehead, cheekbone, top lip, so annoying, and sometimes even on the angle of the jaw.
That's okay, that's natural contouring. I don't mind having it here. But
I think that's probably a little bit fragrance sensitivity, then that's one of the common triggers for pigmentation on the lower face and neck.
That is interesting. Yeah.
Well, a condition called hyperpigmentation savat, which is sort of red and brown blotchy change in the neck, is almost certainly related to fragrance plus sun exposure. And then the other common type will be what we call solar lentigos, or age spots, as they're rather, unkindly called. And these are like the fixed brown lesions, typically on sun-exposed sites, and they're pretty static, unlike freckles, which will fade in winter and come back in summer. So those are your kind of common categories. So melasma is probably the most tenacious, so if it doesn't resolve after pregnancy is over, or after stopping the contraceptive pill. Yeah. The average person stuck with it for a decade or more.
Oh my goodness.
So it needs an ongoing approach. So that's why I'm not big on devices or lasers, because unfortunately the tendency is within.
They come back.
I know.
Yeah, they come back within a year.
So and sometimes it actually drives the pigmentation deeper in the skin, which makes it harder to treat. So in general, medical treatment works best with melasma. And it's all about your UV and your visible light management. We now know that visible light is a player.
I mean, I just don't want to
getting it right now.
Because right now
we're bathed in all kinds of light, aren't we?
We really are.
But yeah, so it means that your habits are the first thing to address. So you must have your UPF rated hat. You must have your proper sunscreen. And I have to say, I really like high percentage physical block for that purpose, because and ideally it's got a bit of iron oxide in there as well, because then you get the longer wave UVA and the visible light protection. It is higher coverage foundations are your friend, actually, because they have that pigment in there that again helps. Yeah, it's the one time I'm actually like a fan of more high coverage products. A lot of brands are not terribly, revealing of their iron oxide percentages, and I really wish. So if any of you guys are listening, be more transparent about that, because it's actually an important active ingredient.
Well, the thing is, it's not that
proprietary
important.
claim is commonly touted and they won't share. But actually, Aven, for instance, do a high protection compact with a high percentage of iron oxide, and that's a good thing. So I recommend that to my patients. But if I don't know what it is, I can't recommend it.
Yeah, no, that's actually really interesting, because it's not something, at least for consumers, it hasn't been important.
It's not on their radar.
It's not on the radar, because you always think about titanium dioxide, zinc oxide, and all the chemical filters, but nobody ever talks about iron oxides and the percentages of that. So it should be about how much.
I think I've seen studies showing that 4% is effective and makes a big difference beyond conventional broad spectrum UV sun protection.
That is so. Now I'm going to be like.
So then you get on to treatment. So I think that the things that work best for pigmentation are things that suppress the production of melanin. The gold standard is hydroquinone, 4% on prescription. I think should be supervised by a physician.
Well, it's not something, I know that that has such a bad reputation, hydroquinone. And it is something that dermatologists, who I do not believe are in the business of trying to hurt you, always prescribe as being the most effective. And from my own personal experience, it's the only thing that really worked substantially to get rid of. We're talking like it would make a 70% difference, whereas everything else would make a bit of a difference, but it won't
take it down. Large areas of contrast that are really distracting and hard to cover.
Exactly.
So we came back to this point earlier. It's all about dose. So what is safe at 4% will not necessarily be safe at 10 to 12%. And the problem is people are buying these skin lightening creams without really knowing what else is in there.
They're actually putting it all over their bodies and stuff.
And they come into you and they've been using this stuff for 2-3 years. And sometimes it contains steroids that they're not aware of as well, because that's often part of a triple therapy approach to melasma. So I think, these things need to be used with caution, but I do get the best results in melasma when I combine prescription retinoids with hydroquinone, proper sunscreen. Education is so important. And then the newest thing, which is interesting and I've been getting great results with, is oral tranexamic acid. So medication traditionally used by gynecologists for women with menorrhagia or heavy periods, however, is kind of a wonder drug in the right instance. So,
but I am very curious. I actually really want to try that.
Yeah, I mean, I've had great results in those who have maybe gotten 80% better,
Mm.
and like we've really struggled that last 20%, and you just throw a little TXA in, and you know it gives fairly long-lasting results as well. So
I think we covered most of
As a
the more
dermatologist.
popular. Exactly. You know, honestly, people have to pay for this kind of information, so I am really grateful to you. Thank you so much.
a pleasure.
Yeah.
I really enjoyed talking.
Go and subscribe to Dr. Sam's channel. I learned so much from there, just really practical. You know, people think I'm direct. You're very direct. You just get on. I mean, you basically just get on with it, make it very easier. Thank you so much for watching. I hope that you found this really helpful as I did. And until next time, I'm wishing you great skin health.
Bye for now.